All right, good morning. Well, actually, I should say good afternoon. It's now lunchtime in Atlanta, and I just wanted to say hi. I'm so glad to be here. I just show you my back view for a second. I'm actually in London, and this is a recorded video for you guys because an unexpected trip came up, and I had the opportunity to have some speaking engagements in London, and I just could not pass this opportunity. I was still hoping to be here actually, but an amazing trip to Stonehenge came up, and I really needed to be there because, you know, it's such a interesting sacred place, and I want to discover if it's true there is some secret portal to an alternative reality. So I wanted to show my background. This is a beautiful London, and now I'm gonna pull the curtains so it's a bit less light. I wanted to express my gratitude to amazing Cindy, and she became one of my friends. We had so much fun working together on her skin. She became my brand ambassador. Thank you for organizing this webinar. And I'm looking to meet all of you in person soon. I'm planning to keep it short. I know you're all busy, so this will be maybe like a half an hour webinar. You'll have my beautiful assistant Shay with you as well in case there are any technical difficulties, questions. I would love for you ladies to send me your questions via the chat. In fact, I'm gonna try to log in from Stonehenge, so at least I can be present on the chat. However, if I cannot, I will take my time and answer every question as soon as I'm back, or if it's even easier, you can just text us 678-732-9065. Shay will put all those numbers in the chat. Email me, it's drneacsu@mcmatlanta. And again, I would love for you ladies to come see me for a complimentary skin consultation. And so we can talk a little bit more about your own individual skin concerns. Welcome again. I'm Dr. Dana Neacsu. I'm a physician, medical doctor trained in both conventional and alternative medicine. And my practice is your typical functional medicine integrated practice where we see autoimmune, gut health, hormonal issues. But lately, because of, I like to blame it on my girlfriends, especially my Russian brigade, they really wanted me to add something for skincare. And, you know, honestly, I was noticing even my own patients, you know, as they were getting healthier and feeling better, they really wanted to have that last step where they wanted their image to match how they felt, and they wanted their skin to look great and luminous. And so I said, why not? After all, I'm 47 years old myself, and I could always use some help. I am, however, all about a holistic approach. I am all about a non-invasive approach because I'm a busy person. I'm a single mom, work 2 different jobs. I still go to the hospital because I love that part too. So there's no way I can be at home for, I don't know, 10 days or so to recover. So everything I brought in my practice, maybe with the exception of microneedling, where you might have that 30 hours downtime, everything else is really non-invasive. So you walk out of my office and you look like $1 million. I'm gonna pull up on my screen a quick PowerPoint presentation so I can show you some of the techniques that we use. Again, I'm gonna keep it short, and if you have any questions, absolutely let me know in the chat, and I will definitely address it. And let's see, we go. If I got the right one, yes, that's it. And I'm gonna start to the beginning. All right, so I actually had this presentation for the first time at a bridal exposition show, because I think, again, this is great for any upcoming not just weddings, but any kind of events. In fact, I was just like so mad at myself because I forgot to bring my plasma pen. And I could definitely use it now, after the jet lag and going straight into business events or speaking engagements. I was like, oh, God, why did I do that? I should have brought it. But anyway, it's really a functional medicine approach to your skin, because I do think it's not just about the serums and the lotions that you put on top of your skin. And don't get me wrong, I think those are important. In fact, I had a couple of months ago, I was invited by Dior Atlanta for an educational workshop. And when we're going over the steps, which I'm going to share with you, exactly the same thing, I matched their creams or the serums with the steps that I'm taking for my own patients. And they're like, wow, it just absolutely makes sense. And it does, it really does. So this is about how can we heal our skin, rehab our skin, make it look better, make it look 10 years younger, but still looking like ourselves, right? Because that is one of my pet peeves. I think people, and not just women, some people wait too long. They don't take care of their skin. They wait too long. And then suddenly, you reach that 50 or whatever that magic age is for you. And then we panic. And then at that point, we just do too much. And, we do tons of Botox and we do tons of fillers. And, as I tell everybody, hey, if this is what you decide to do, I'm not completely opposed to it. I'm all about using it in a very intelligent manner, meaning I tell my patients, this is not about instant gratification. It's about rebuilding your skin health, the texture, the luminosity, and then you draw the line and use something more if needed, because otherwise you will end up with that artificial look that none of us like. Or sometimes I do see patients with a very, their skin texture doesn't look normal anymore. It's almost like, I know this is not the best comparison, but when you polish a shoe way too much, it's just too shiny and it doesn't look good and it doesn't really look like leather anymore, right? So this is my philosophy. Let's start with basics. Let's address every step the way, and let's make sure we're not missing a basic hormonal dysfunction. And you just keep trying to apply lotions and, Botox and, whatever else you might want to do. I guarantee you, unless you fix that, unless your body is in balance, you're not gonna get those 100% results. So why people like my skin? Clearly, again, I'm 47. I promise you, I do have wrinkles. But people still like my skin. And you know why? Because, again, it's clear. There's no acne. It's most of the time, unless I travel and I don't take care of it, it's luminous. And there are actually major studies that showed that it's not about, oh my God, you have a wrinkle. It's people are looking for that youthful appearance. They are not bothered if you have wrinkles, as long as your skin looks healthy. So what I'm going to talk about and what I'm planning, I'd love for you all to experience, is my, I would think, unique skin protocol. And I'm going to take you through those steps one by one. Again, not being able to know your own individual skin problems, but just as a general rule. And I'm hoping to meet you and figure out that part, those individual challenges. So I'm going to start with hormones, ladies, because whenever a patient is coming to see me for the skincare, I use that time, they're in the room with me, they can't run away, they're stuck, right? I use that time to actually start guiding them and explain to them what it takes for your skin to look great. And I think we all agree that balancing the hormones are pretty much, I don't know, I think to me, it's the most important step. How can you expect to have a great skin if your thyroid is out of whack, or if you have too much estrogen and you're retaining all that water and you're puffy and dark circles, and it's just not possible, right? So we always start there, whether we have to get rid of that extra estrogen or we need to balance your thyroid. That's where you gotta check it out. You gotta put it back in balance. And as we're doing that, I also try to make something really important as well. And that is actually the vitamins and minerals and antioxidant levels. Because see, when you go to see your primary care physician, you'll most likely get maybe a vitamin D, maybe a vitamin B12, if you're lucky or if you have some symptoms. But in fact, you can check about 30 of them, all the B vitamins, vitamin C, vitamin A, D, all the minerals like zinc. Zinc is so important for skin health and for the skin healing. All the antioxidants. I think we all agree that that's something that our body needs in order to get rid of those, toxins, toxic metabolites, excess hormones, you name it. Every vitamin has its role in skin healing or skin health. Vitamin A, vitamin D. And what I wanted to remember is, though, we all think about our skin as just an image and, something that will make us look good. But in fact, the skin is important for our health as well, because the skin protects you from the, environmental toxin. Your skin will help produce some of the vitamins, like vitamin D. That's where the that whole chain reaction starts. That will end up with vitamin D. So, the skin is important for detox. I mean, my gosh, that's one of the most important organs for detox, right? That's why one of the things I recommend to my patients is also that dry skin brushing and having a shower head filter. It will, if you do one thing, just do that today, tomorrow. Buy a shower head filter. You'll be amazed how will change everything. Your skin will look better or feel better. Your hair will look better. So bottom line is, this testing is done as a first step. Everybody that walks in my office, whether it's skin or some other concerns, these are few things that we always check because they're that important. Once we address this, right? Actually, I'm gonna show you something else first. We go into talking about nutrition. Again, I'm sorry, I know nobody likes that. It's our weakness, or for many of us. But eating foods that are not right for you, pro-inflammatory foods, will affect the way you feel, and not just your gut. You're gonna see it on your skin. Having allergies to not just the pollen, but also to certain foods will create some of those dark circles that we all hate, or will accentuate them. So going into an anti-inflammatory diet at minimum is step number 2 for, again, most of my patients. And we talk about it. You don't have to change your diet completely. You don't have to feel like you're missing out. We're talking about replacing certain foods that are not great for you with foods that will fuel your body and your skin, and will have enough omega-3. That's a big one, right? The healthy fatty acids. I mean, it's just so needed for our skin. I mean, forget our skin, it's needed for your brain. But that's what builds the skin. So this is something that you have to think about. Sugar, I'm not going to get into that because you guys are smart. You know that. I can tell you, I have no problems with my skin. But if I eat sugar for about 2-3 days, 2-3 days, that's all it takes. Maybe because my body's not used to it anymore. I feel it. and I'll show it. It will show on my face. I guarantee you that. So just think very well about it. What I wanted to show back now is, and then we'll go back to the previous slides, is step number 3. I call it ancient medicine facial techniques. And I like it because I like this slide, it's so much colorful. I like that because it's really about using different methods with a goal of stimulating the blood flow, the lymph flow, massage those muscles, help them tonify, and just looking great. So I'm talking about gua sha, which is Chinese, traditional Chinese medicine. I'm talking Kansawan massage, which is Ayurveda. I'm talking acupressure, I'm talking massage, I'm talking facial yoga. You name it, you have to use some of those. And we teach our patients after they go through that initial phase, we teach them how to use it at home as a maintenance, or at least do whatever, few small steps. Again, when I went to that your workshop, one of their national super smart educators was there, and she was demonstrating an amazing massage. Literally at the end of that massage, you look like you're just at least a couple of years younger, because it was lifting up and just tightening everything. It was amazing. So gua sha, Kansawan, acupressure, facial yoga. We do that as a part of our routine in my office, because you need to start working to the muscles and the skin depth, not just the superficial layer. Next, liver detox. Ladies, everybody should go through this. I do it myself 2-3 times a year, maybe more often if I have some crazy years like the past year, right, with COVID and everything. It's not that complicated. You can choose to do maybe 1 week of healthy smoothies, especially if you add cilantro, dandelion, bitter herbs. Everything that's bitter will stimulate your gallbladder, your liver, will help it, kind of release those juices, will help it function better. So you can just do that. And of course, we all know how important hydration is, and I'm not going to go into that, but that's huge, not just for your skin health and, looking young and plump, for everything, but we know that. But the liver detox, again, you could just do it by yourself with a healthy, light, 1 week cleansing diet, lots of smoothies. There are a bunch of recipes online. However, I like to do it in my practice with specific detox kits. And I am not talking about sending you to the bathroom 10 times a day detox. I'm talking about specific nutraceuticals and nutrients that your liver needs in order to optimize its function and go from 50% to 100% function. So it's most of the time something that looks like a protein powder, and it's also, or it contains also certain supplements that will basically fuel your liver. Because if your liver functions well, it's you done your job. Your liver will do its job. Your liver will get rid of the toxins, excess estrogen, you name it. So your skin will look better. You'll feel better. Everything, your body, you feel lighter. I can tell, I do this with my patients, again, not just for the skin, pretty much in everybody who walks in, because think about it, we're surrounded by, as much as you try, we're surrounded by high load of toxins, in addition to what our body produces. And, we might not get rid of it in an efficient way. So nutrition, ancient techniques, liver detox, testing, and then we're going into what you guys like, because I get to do all the work. You just, you're just getting there talking and relaxing, unless you're Cindy, who called me Dr. Frankenstein because I was doing microneedling on her. But that's a different story. She'll tell you about that. We really have fun. I mean, Cindy's laugh is amazing. But here are the few things or devices that I use in my practice. This is an amazing skin laser. It's European based. And the reason I like it is not because you get to work on, dermal health, acne, sun damage, that redness that, we get around the cheek area called rosacea, wrinkles, but it's completely non-invasive. You literally walk away. You have no downtime. All I want you is, of course, to avoid sun. And I mean, sunbathing, not, going to get groceries. I want to avoid the sun for about 72 hours. Other than that, there's really nothing. I can tell this changed my life because again, I just don't have the time to be at home healing from something more invasive. This will require a couple of sessions as what we call restoration phase. And then you'll do it as a maintenance, one session, maybe, 6 to 8 months, depending on how much care you take of your skin and, where we started. But this is amazing. It really, and at the end of this presentation, there'll be some pictures that, before and after, and we have some more on my page. If you go to wmcimatlanta.com under the functional skincare page, you'll see some of this before and after as well. Another method that I use now, this is a bit invasive, meaning you'll have about 30 hours of some redness, right? It's microneedling. Now, some of you probably heard about this or had it done before. I personally never done it until I actually did it on myself. And by the way, I'm doing all of this on myself. So, it's kind of funny with, and a bit, less funny when I do the microneedling, but we use for the some numbing cream as well. But the microneedling will create tiny channels on your skin or entry sites. So then when I apply the exosomes, those exosomes will get into the skin and act as messengers, basically tell your skin, hey, I needed to produce collagen, I needed to produce elastin, and all those important nutrients will now flow to your skin and will heal, will force it heal. And in the process, of course, will make it look younger and tighter. Exosomes are stem cell building blocks. And it's kind of the new kid on the block. I like it because it's a, it looks like actually like I'm giving some shots, but no, those tiny bottles, you just mix them up. And it's a clear solution, right? So, when you leave the office, you will have it on and you keep it on for 24 hours, but it's not bloody. It's not like the vampire facelift and, I'm from Transylvania and I still don't like that because it's just like horrific looking. So the exosome treatment has been used not just for the face lately, but also for hair growth, orthopedic procedure. It's amazing. So we do that as well in conjunction with everything else I showed you. All right, my last secret is the jet plasma pen. Now this is what I was complaining about. I forgot to take it with me because what you don't see in here, it's also a wand that using microcurrent. And in conjunction with this device here, gosh, it's just your face, it's suddenly tight and, no wrinkles. And this right here, it's just, pulled up, and it's amazing. The skin tightening effects of the plasma pen are amazing. Now, what you see in the picture is actually what we call the gold tip. This is really super powerful, especially for the eyelids right here, this laxity that we get with age. with this, you do have a downtime about 3 to 5 days. There's some redness or scabbing, but the silver tip that's not shown here, that is completely non-invasive, along, of course, with the microcurrent wand. So I just wish I would have brought that with me, had it on myself the night before, Monday night, because it really is amazing. So what it does, it's actually using that spark that comes out of that little tiny wand or tip. That spark creates a chemical reaction that involves the gas right above our skin, right? Those gases. And then that heat, that energy is transmitted into the skin, and it makes it just tight, stimulates again the collagen, elastin, and it's just, it's almost, people don't need really, unless you have a major problem, people don't need blepharoplasty, which is basically, that surgery right here to deal with this eyelids laxity. It's amazing. And honestly, even with the gold tip, even having to wait 3 to 5 days, it's so much better than having surgery on my eyes and having to wait a couple of weeks. So this is my third secret, so to speak, and what I use in conjunction with the microneedling and the laser once we address, or kind of parallel with addressing all the underlying hormonal imbalances, micronutrient deficiencies, getting your liver up to speed, and again, making sure your foods are not sabotaging your skin. I would like you from now on to think and keep in mind that this is a truly holistic approach to the skincare. And unless you build your beauty from inside out, unless you treat your skin from inside out, and then you finish off with devices and proper skincare and SPF, you will not get those amazing results. And again, once you've done this and you draw the line, you look at your results, look in the mirror. If you decide that you need some more, that you need something else to just erase that pesky wrinkle that's bothering you, that's fine. But I just want you to first look great, to restore that skin health, and not, again, just look for instant gratification. I hope you found this information useful. I hope this is, the horrific skin. I just like that word, but really it's about, I want to look young, definitely not artificial. That would be not me. I want to have glowy skin. I want my skin to look healthy. And I really think that's what a lot of my patients want. These are some of the before and after pictures. Again, most of them are on my page, wmcimatlanta.com, under the functional skincare. These are all, real patients. I love the results on the neck, by the way. If you look at this picture alone, because I think many times we don't think about our neck and then it just shows our age, right? But if you look here, this is literally after the laser treatment, right away after the laser treatment. And you can tell there is no, redness. There's no, it's non-invasive. She walked out of my office and she was just happy. And I'm gonna just finish with this slide because I think this is kind of sums it up for us. I would love for you guys to text us, call us, email us. Shay will keep in touch. If you just, even put your name and your contact info in the chat or text her, it would be great. We'll follow up with you. I would like to meet you all and just have you come over for a free skin consultation and for even trying one of the devices, maybe the plasma pen or the laser, maybe right here around the eye area, because they both can work in the eye, under the eye area, which I was crazy about it when I heard about that, because that's where we have the problems, right? So maybe we can play with it so you can see and feel on your skin how it works. And we can talk some more about what your needs, your specific needs are. Again, I thank you so much for being here. I apologize for not being live, but I just didn't want you to miss this opportunity. Shay is with you. If you need anything, I would love for Cindy to share her own experience if she can. We're not done with her treatments. We just started, but she had an opportunity to try a little bit of everything. And, you know, like I said, we had tons of fun doing it. If you have any questions for me or, you know, specifically about the skincare, please let me know. And I'll promise I'll answer them all. Thank you for being here and look forward to hear from you.